These brain areas are just not playing well together. Now, the task networks include a different set of structures. It still involves the prefrontal cortex, but it's a different part of the prefrontal cortex, okay? Tends to be the medial prefrontal cortex. And there are some other brain areas that the medial prefrontal cortex is communicating to all the time, mainly to suppress impulses. It's shutting down the desire to stand up or to scratch the side of your cheek or your nose if you're trying not to do that. Anytime you're restricting your behavior, these task-directed networks are very active, okay? Now, normally, in a person without ADHD, the task networks and the default mode networks are going in kind of seesaw fashion. They are actually what we call anti-correlated. So it's not just that they are not correlated, they are actually opposing one another. They are anti-correlated. In a person with ADHD, the default mode networks and the task networks are actually more coordinated. That might come as surprising. I think that we all have this tendency to kind of jump to conclusion and assume that somebody who doesn't have an easy time paying attention or has ADHD, that their brain must be completely incoherent, that it's not working well and because everything's out of whack. But there's something interesting about people with ADHD whereby the task networks and the default mode networks are actually working together in a way that's correlated, and that is what's abnormal. So this would be like the guitar, bass, and the drums playing together in a way where the bass isn't keeping the backbeat and the drums aren't keeping the backbeat, that they're playing together. They're all playing the melodies and harmonies in a way that just doesn't sound right. That's what's going on in the brain of somebody with ADHD.